Overall, neurotoxins are really great entry level into aesthetics, whether you're a patient or a practitioner. If you're a patient, this is a temporary treatment. It'll last 3 to 4 months. Whether you love it or you don't have to live with it forever. So you can kind of get your feet wet, and see what it feels like for you. You can also play around with it, see where you like it, where you don't like it, see how much of it you like, because you can play with the units, right? The more you inject, the more frozen of a look you have. The less you inject, the more natural movement you will kind of retain in the face. You can also sort of play with how much, for instance, brow lift you want, how much maybe you don't, etc. Just kind of nuances to discuss with your injector. If you are a provider trying to get into aesthetics, this is, a nice sort of way to sort of start your journey. Learning facial anatomy obviously is important, or I should say, relearning your facial anatomy is really important. Once you start to kind of remember where the muscles are and how they move, it becomes much more intuitive to you where to inject and how much. Everyone sort of has a very different style, but kind of discussing with your patient what look they're going for is really important. There's a lot of medical applications to it as well, which is, very beneficial to patients. And, I've had great results with it, from the medical aspect of things as well with my patients. So overall, it's a really great product, especially if it's used correctly in the right sort of dosage for the right patient.